This is a photograph perhaps you've seen previously. This was a visit to the Dadaab refugee camp on the Kenya-Somali border. And I had the chance to visit there this past summer. Dadaab is already the world's largest refugee camp. It took a huge influx of the 290,000 Somalis that left Somalia because of the combined crisis of famine, of conflict, of drought, and of extraordinarily poor and difficult governance situations. Now, you've probably been talking about this today. I know General Hanna mentioned this, but food insecurity in the Horn of Africa, as a result of all of those forces coming together, have put millions of people at risk. And in fact, by the time we got to about September of last year, we all know that more than 13 million people faced serious hunger and starvation, and we know that more than 35,000 children under the age of 5 inside of famine-affected areas have already perished because of a lack of access to basic sustenance and the vulnerability that then creates. Now, many people come into this camp after an excruciating 70, 80, 90-kilometer trek. Women, mostly women and children, women often holding children. And when they get there, they have the opportunity to hopefully receive basic services, food, health, certain items to protect themselves. We know from experience, and the humanitarian and operational partners that work on these problems have gotten much, much, much better at understanding the types of interventions that are most effective at saving kids' lives and human lives. Despite the fact that a famine is mostly associated with the lack of food, it's often health interventions, clean water, vaccinations, antibiotics, and others that actually save lives. This was inside of a health facility. Actually, a small health facility was completely overwhelmed. I had the chance to meet this young 4-year-old boy, and in learning about his situation, I had frankly overlooked until a moment later that his younger sibling had passed away that morning and was still on the cot. And this is the kind of reality that results from the excruciating circumstances that were created by the combined famine, war, and drought. But we've also learned a great deal about how to address these problems. We can address them in an acute setting, we can address them in a broader one. We know that health interventions save the most lives, so we vaccinated more than 1.5 million children against polio and measles. Frankly, we know that pneumonia and diarrhea kill a lot of these kids because they don't have the immunology to protect themselves from basic diseases. And today, thanks to some unique efforts made by the Obama administration and a global alliance called Gavi, the Global Alliance for Vaccines and Immunization, we were able to negotiate major price reductions in new vaccines for pneumonia and diarrhea. And I was thrilled to be able to walk through that camp and see little kids getting a vaccine product called Pneumovax, which up until very recently was considered too expensive for these settings. At $56 a dose and 3 doses required, people weren't even trying to get a vaccine that we've all been using for our children in this country for decades to kids who actually need it more because they're far more vulnerable of death. We've expanded our efforts to provide basic therapeutic foods by changing the mix of food aid and bringing more science and technology to have ready-to-eat, high-protein, high-micronutrient foods. And in really an innovative partnership that I think represents the future, we were proud to work with Pepsi and with the government of Ethiopia to try to reach 30,000 chickpea farmers in Ethiopia, help them grow more and better chickpeas so that Pepsi could build a hummus product and a proper supply chain. And they say, what does that have to do with this? Well, half of the product they're going to create will be packaged as a high nutrition paste and delivered to children in the region who need that to survive. And because we were able to guarantee the purchase of that volume for a certain number of years, it made the economics work for Pepsi, and it allowed the United States to leverage its resources considerably. Those are the types of partnerships that I think are coming to really define the future of development. But we all know that relief is not enough, and I hope and I know that much of the focus today is on thinking beyond the immediate time frame, think about how do we actually protect large vulnerable populations over the long period, or more accurately, how do we help them protect themselves? Well, later this month, we're pulling the global community together in Nairobi to invest in what we're calling a resilience strategy for the Horn of Africa. Because we know that even very vulnerable populations, pastoralists that live in dryland environments, who are right at the edge and the first sets of families to suffer greatly from drought and hunger, we know that they can be protected. This is a group of pastoralists in Kenya who are receiving, who are part of a program that's a partnership between USAID and Swiss Re. Swiss Re is a major reinsurance company. And the reality is new advances in science, both weather measurement and actuarial science, make it possible to actually package and sell with some subsidy an insurance product to these pastoralist households. So during the drought, there were 600 families that got insurance payments because of this effort. And the reality is we know that producers, food producers, agricultural producers everywhere around the world receive some degree of risk protection, subsidy, and support from their governments and their societies. And it's extraordinary that the most vulnerable amongst us are the ones that actually don't. So these types of efforts, bringing new science, new partnerships, new technology right to the front line of protection, can actually lay the basis and the groundwork for longer-term development. And later that same afternoon, we had a chance to visit, this is with Dr. Jill Biden, the Kenyan Agricultural Research Institute, not far from Dadaab, a couple-hour flight, not even. And at the Research Institute, we saw a range of new technologies that they were creating as part of a partnership with the United States called Feed the Future. President Obama took office, he said, tackling food security and hunger is something we can and we will do. He brought other world leaders together, made commitments of nearly $22 billion totally, and reinvigorated agriculture in very poor parts of the world with infusions of science and technology, new partnerships, new resources, new private sector investments. Today we're seeing the real results of that. In parts of Western Kenya, we saw maize yields go up 200, 300% because of improved production practices. We saw orange flesh sweet potatoes that have more beta carotene so that when kids consume them, and they like consuming them because they're softer and sweeter than the alternative, they're protected from river blindness. And we can actually do serum blood sample testing, and we can see the level of protection that results from their shifting their basic food consumption patterns to these types of improved products and technologies. We know that in countries like Bangladesh, for example, for the first time in decades, they had enough rice to feed their population because of the combination of our Feed the Future efforts and their own domestic decisions to prioritize investments and to liberalize the agricultural economy. So we know that we can see success. The challenge, of course, is seeing it take place at much greater scale. This year, we'll be working to accelerate this program considerably. We're already working in 20 countries. In those 20 countries, we think we can help move 18 million people out of poverty in a sustainable way. But what's important about that is not just moving people out of poverty. It's about actually noticing that when you do that, people make better decisions about their own futures. They have fewer children. They invest in sending those kids to school. Those kids become the engine of further progress, and entire countries and societies can grow and diversify their economic base considerably. I share all this and would like to conclude with this slide, just a photo of a visit and my opportunity to meet with Ambassador Eikenberry and Lieutenant Colonel William Johnson in Afghanistan. And I know that over time, folks in the development community have at times been skeptical about deep partnership with military institutions. I think we are beyond that. I think it is now broadly recognized, and we need to keep hammering away at the fact that if we're going to protect our own security in a smart, sustainable way, we do better by investing in creating more South Koreas and fewer North Koreas. And that if we bring science and technology to that task, if we bring the real results orientation to that task, we can actually do that in a way that is more sustained and more effective than it has been in the past. So I appreciate the fact that you all are taking today for this conference. I look forward to a short discussion. And I really think just stay with it. Keep talking about the fact that as partners we can accomplish so much more together than we can by thinking of ourselves apart. Thank you.